of everyone. So already tells you that we are dealing with synergy, because we say the word combined, and then unceasing. Quality, we never arrive at quality. I don't know if that's a good English sentence, but all I'm trying to explain is that in quality improvement, we talk about the true north, and the whole concept around the true north is that when you leave South Africa and you say you're going to the North Pole, when you get to that pole, which is in the north, you'll realize that it's not an end. You can still go north, right? Where we are, we said, what is quality? What is quality improvement? And I must say, maybe let me clarify as well. Well, in the world of quality, we talk about Dr. Juren. It's Juren. His name and surname was the same thing, Juren. But there's what we call the trilogy of Juren, or Juren's trilogy. So he sort of puts quality into three phases or three components. There's quality planning. Like, let's say you are building a hospital, you have to plan as you build. To plan and build for quality, you're planning. So you must plan for quality, looking at the standards and all the regulations. How do you plan for quality? So you plan.